Now, the odds are you've already been to your primary care provider, and you may have even been to the emergency room because your symptoms were so very severe. They've ruled out UTI, and they've now referred you to a urologist or a urogynecologist for a proper diagnostic workup. But before you go, you need to do some work at home to really optimize that first appointment. And the first thing I need you to do is to start tracking your symptoms with a voiding diary. How often are you getting up? Are you getting up 2, 3, 4 times a night? How often are you using the restroom during the day? Take some time, a couple of days, and just write down the time that you go to the bathroom so that we have a really good idea of how this is affecting your life. Do you have urgency? Urgency means that you're either running to the restroom to reduce pain or you're running to the restroom to try to avoid leaking. Think about that for a moment so that you can tell the doctor the answer. Do you have pressure? Do you feel a heaviness in your pelvis that gets worse throughout the day? That's an important symptom. And of course, do you have pain? Now, pain is fascinating here because there can be lots of different types of pain in the typical IC patient. So, is your pain inside of your body or on the outside of your body? If it's inside of your body, where? Is it in the urethra? Is it in the rectum? Is it in the vagina? Is it in the bladder? If the pain is on the outside of your bladder, where? Is it by your rectum, on your vulva, etc.? Pain on the outside of your body is not IC, it's not your bladder. The odds are you have estrogen atrophy, also known as genitourinary syndrome of menopause. Now, the devil is also in the details here because you need to pay attention to any weird random symptoms. The once in a blue moon symptom that makes no sense to you, like, do you ever feel like you're sitting on a cell phone on vibrate? A fluttering feeling? Or do you ever have pain that shoots down your leg, like sciatica? Or do you have pins and needles or areas of numbness? Or something that we call PGAD, that's persistent genital arousal disorder. That's where you feel this painful arousal sensation. You're never going to tell anybody about it because it's so incredibly embarrassing. But it's very, very uncomfortable and certainly not enjoyable. All those are symptoms that you have muscles that are squeezing nerves, and these are important symptoms for your doctor to know. Now, the other thing that I need you to pay attention to and really think about here is your history, especially history of trauma. So, is there any event that you associate with the onset of your symptoms? Did you have a baby? Did you fall? Were you on vacation? Were you abused? Let me give you a really good example. I was working with a young 23-year-old man with very severe pain, very severe IC, had to drop out of college, was basically in bed. It's a really difficult situation. And I asked him a very important question, and that is, what event do you think triggered your symptoms? And he goes, I know exactly what triggered my symptom. I fell off the ski lift. My symptoms started that night. He was clearly a pelvic trauma patient. And in hindsight, I was really shocked that no doctor had asked him that question. So I need you to think about trauma, especially in the last 10 years prior to the onset of your symptoms. Had you had children? Were you torn? Do you remember any falls? Did you fall on your tailbone? Were you in a car accident? Did you break a leg? Are you an athlete? Were you a football player? Anything that involved direct pelvic trauma? Were you a bike rider that puts trauma directly up into the pelvic floor, onto the nerves and muscles through the bicycle seat? Were you a motorcycle rider, horseback rider? Were you involved in sports that involved multiple falls, like gymnastics or ice skating? Or even something as benign as dancing. Ballet actually really tweaks out your pelvic floor and can make it very, very tight. So that history of dancing is actually fairly common. So I want you to be able to walk into that doctor's office with your head held high, looking the doctor straight in the eye, no shame, absolutely no blame. You've done nothing wrong. You are there to get an independent assessment of what could be causing these symptoms. And I want you to very confidently say, Doc, here it is. I can't sleep through the night. I have not slept through the night in the last 2 years. Or, doc, I don't know why, but every time I sit down, I'm in agony. Can you please help me understand that? You have the right to ask for help. You have the right to medical care, but I need you to be very involved, very engaged, and be very involved in that conversation. So my next video, I'm going to talk about what the doctor is going to do during that first appointment.